Are you pregnant and not yet had your screening for gestational diabetes? Have you heard of the screening for gestational diabetes? What if you've had gestational diabetes in a prior pregnancy? Is that important for your next pregnancy? There can be so many discussion topics about gestational diabetes, and I want to make sure that we can go through and answer some of those today. So let's talk about gestational diabetes. Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal fetal medicine specialist, which just means a high-risk pregnancy doctor, and today we're talking about gestational diabetes. So we are going to go through quite a bit today to expand our knowledge, develop skills, and hopefully have an impact on you and your pregnancy. Before I get there, as always, I want to remind you that you can download a nice little form called an advocacy assistant at drlexihill.com/advocate. And this is a sheet that will help you with some basic questions for your pregnancy, regardless of gestational diabetes or not. Okay, we'll also have more downloads later that you can see below, and you can click on those links to get to the website. The other thing I want to tell everybody is that there are modules on my website for individuals who have diabetes prior to pregnancy. So that's pre-gestational diabetes, we call it. So if you're diabetic before becoming pregnant, this is not necessarily applicable to you. This is for individuals who do not have diabetes going into pregnancy and then develop diabetes in pregnancy. Therefore, we call it gestational diabetes. All right, so let's start with expanding your knowledge. First off, let's go into the definition of gestational diabetes. So just so everybody out there knows, being a maternal fetal medicine specialist, there are certain things that we deal with quite a bit on a daily basis. And one of those is diabetes. Now, if we think of the definition of gestational diabetes, that is technically diabetes that is diagnosed in pregnancy. I'm going to break it down a little further, because when we call something gestational, so if we call it gestational diabetes, diabetes during pregnancy, gestational hypertension or high blood pressure during pregnancy, gestational thrombocytopenia, which is low platelets, that's low platelets during pregnancy. The technical definitions of those items, when we say that they are gestational, means that they are diagnosed after 20 weeks of gestation. That's a typical cutoff we use. So that would be applicable to this as well. So if you have gestational diabetes, it would be diagnosed after 20 weeks. And I bring that up because when we talk about gestational diabetes, everyone needs to be screened. So the definition is you are diagnosed after 20 weeks. Now, that's important because if you are someone who needs early screening for gestational diabetes, let's say, for example, you have a very strong history of diabetes in the family, you had a prior child who was born what we call large for gestational age maybe, so the weight of the baby was high, or maybe you had gestational diabetes in a prior pregnancy. These are things that might get you diagnosed during a pregnancy prior to 20 weeks. And then that's a discussion with your provider to see how they are classifying your diabetes. All right, so that was a long definition of gestational diabetes there, but basically diagnosis of having diabetes after 20 weeks gestation in a pregnancy. And most of the time, when you get screened for gestational diabetes, this occurs around the 24 to 28 week mark. So clearly that's after 20 weeks. So that's the kind of slam dunk definition there of diabetes. And people, again, are screened around 24 to 28 weeks along in their pregnancy. All right, next thing for expanding your knowledge a little bit surrounding gestational diabetes. Why is it important to us? Well, we see diabetes, any type of diabetes during a pregnancy, in about 7% of pregnancies. That might not seem like a lot to you, but that's about 7 per 100, right? So about 7%. Of those individuals, gestational diabetes makes up approximately 85% of the cases. So most of the diabetics that we see in our office on a regular basis as high-risk pregnancy doctors, or even just physicians that are your OB providers, the most common type of diabetes that we see is gestational diabetes. The other reason that gestational diabetes is so important is that when individuals are diagnosed with this classical gestational diabetes, the risk of them having diabetes later in life, in their lifetime, ranges anywhere from 15 up to 70%. That's a big number. So if someone told you that you had up to a 70% chance of developing diabetes, later in life, wouldn't you want to know that, right? That's also what brings me to another portion of why it is so important to be screened for diabetes, called gestational diabetes, during a pregnancy, is because individuals who have gestational diabetes during the pregnancy need to be screened in the postpartum period. So when you go back for your postpartum visit, somewhere from 4 to 12 weeks after you've delivered, you are supposed to have another screening to make sure you don't currently have fulminant diabetes, which most of the time is going to end up being type 2 diabetes. That needs to be tested, okay? And the other thing that's really important is that when people get tested, about a third of them in that postpartum period ultimately end up having diabetes after they're pregnant. How important is that then, right? I mean, having gestational diabetes, getting tested for it, knowing your risk factors so that then you can follow up with the appropriate tests, so important to know that. All right, so we've talked about the definition of gestational diabetes. We've talked about the importance of gestational diabetes. Now let's spend a moment on how do you get tested for gestational diabetes. So typically there are two different ways that a provider's office could test someone for gestational diabetes. The most common way is called a two-step process. First step, you go into a lab, you drink this amount of sugar, this glucose drink, they call it a glucose tolerance test. And then an hour after you have consumed this sugary, some people say it's even a little salty, the sugary salty drink, they draw your blood to check your glucose level. And that's called a 1-hour glucose tolerance test. If that test comes back elevated, and elevated is different for different people, some use 130, some use 135, some use 140. So if it is elevated, then your provider would send you for something called a 3-hour glucose tolerance test. Kind of like the same thing. The only difference is that first test would not be fasting. This test is a fasting test. So you would go in fasting, you drink another big sugary drink, and they draw your blood fasting. So before you actually start that drink, and then after the drink, they draw it at 1 hour, 2 hours, and 3 hours after you drink the sugary drink. So you're getting poked 4 times. These aren't finger pricks. These are actually like blood draws that occur. So you're getting your blood drawn 4 different times with a 3-hour glucose tolerance test. So then you're probably asking, okay, that's a 2-step process. We had the 1-hour glucose test. If it was elevated, now I have a 3-hour glucose tolerance test. Well, then how do we know if I'm diagnosed in that 2-step process? Well, if 2 of the 4 numbers of the fasting, 1 hour, 2 hour, 3 hour. So if 2 out of 4 of those are elevated, that is the diagnosis of gestational diabetes. All right, so that's the 2-step process. What if your doctor's office or provider's office is doing a 1-step process? So you don't have to do the 1 hour and then the 3 hour. You go into the lab, and for that test, you would go in fasting, and they take a fasting blood sugar level, a 1 hour, and a 2 hour. So you get poked 3 times for a 2-hour glucose test. And there are cutoffs that they use, and if 1 out of those 3 are elevated, that can be the diagnosis of gestational diabetes. Most places use the 2-step process. Some use the 1-step process. So that's something when we get into our developing skills that you need to ask your provider so you know what to expect when you go to the lab to get this test performed. All right, so we expanded our knowledge surrounding the definition of gestational diabetes, the importance of gestational diabetes, and a general synopsis on how the evaluation for gestational diabetes to get to that diagnosis, how that's performed. So we've talked about those things. So now let's move on to developing skills. And I'd like to kind of formulate a few questions to pose here. And these would be great questions that you can ask your provider. And then I'll go through some of the basic answers to these as far as why they are important to talk to your provider about these questions to further advocate for yourself to get appropriate and timely screening for gestational diabetes. Question number 1, when am I getting my gestational diabetes screening? This is super important. So as I kind of mentioned earlier, everybody should be screened in every pregnancy. Now recall, we are talking about individuals who do not currently have diabetes. So if you're going into a pregnancy with diabetes, this doesn't apply to you. So say we're going into a pregnancy without having diabetes, right? Everyone needs to be screened then, in that case, in every pregnancy. All right, so if you're asking again, that question number 1 was, when do I need to get my gestational diabetes screening? The most common time for people without risk factors 24 to 28 weeks of gestation. All right, that's blanket. Now, the reason you're asking, when do I get my gestational diabetes screening, is that you might have a risk factor that elevates the concern for gestational diabetes in this pregnancy. And if that's the case, then you need to get earlier gestational diabetes screening. All right, tons of risk factors come along with this. If you had prior gestational diabetes, so in any of your prior pregnancies, if you had gestational diabetes, they also would look at any comorbidities, like if you have other medical problems or complications, and history of diabetes, as well as things like PCOS or any of the things that can kind of go along with concern for diabetes. All right, question number 2. How is my gestational diabetes test going to be performed? The how is important. So remember when we were expanding our knowledge and we talked about either a 2-step or a 1-step process? This is why it's important to have this skill of asking your provider, how is my gestational diabetes screening being performed? Is it a 2-step or is it a 1-step? That's important for you because if it's a 2-step, the 1 hour, you are not supposed to be going in fasting. And then if you need to do the 2nd step, the 3 hour, you would go in fasting. For a 2-hour test, which is just the 1-step process, the numbers are getting so confusing here, I know. That is something you would go in fasting for. And that's why it's so important to not only ask, when are you getting your diabetes screening, but then to follow up with how is it being performed so that you know for sure if you need to go in fasting or not. Now, I'll kind of sidestep here and give you a little bit of a story from just general practice when I'm working. I have a lot of patients that have come in the past, and they'll say to me, I went in for my diabetes screening for the 1-hour test. So they were going to do a 2-step process. They go in for their initial 1-hour test. And what they've said is the lab wouldn't draw my blood because I wasn't fasting. Now, the 1-hour test is not a fasting test. I will repeat that. The 1-hour glucose tolerance test is not a fasting test. So if someone tells you you need to be fasting, I would ask them why and then have them explain it to you. So maybe they're ordering a 2-hour glucose tolerance test, or maybe they're ordering a 3-hour glucose tolerance test. Those are the ones where the fasting number goes into figuring out if the overall test is considered abnormal or not. Now, the reason I tell people this too is it's very important to try to get it right for the diagnosis. Now, it's not going to be a great idea to have a large meal with a lot of sugar right before you go in for any of these tests, particularly the ones that are actually meant to be fasting. But the 1-hour glucose tolerance test is not considered a fasting test. I want to go back a little bit to the first question where we know that we need to ask the provider when you're supposed to get your gestational diabetes screening. If you are someone who needs early diabetes screening for gestational diabetes, if that first screening, let's say you get it done around 13 weeks, if that screening is normal or negative, whatever your provider says, and they don't feel like you have early diabetes in a pregnancy, they still need to later, at that 24 to 28 week mark, screen you again. So don't let that opportunity be missed, okay? Next question, what do you do when gestational diabetes is diagnosed? What's supposed to happen? So if you end up being diagnosed with gestational diabetes, please ask your provider, what's the next step? The next step somehow should be counseling with someone in the field of diabetes education, whether it's your OB provider themselves, a nurse practitioner, a diabetic educator, a nutritionist, anybody in that space. You need to get more information from someone regarding your diet, i.e., how many calories you should eat per day, and how they should be separated with carbohydrates, protein, and fat. What time of the day should you eat? How much should you eat? Those are things that someone in that world of diabetic education needs to talk to you about. The other thing is exercise. So they need to speak with you and you need to advocate for, please let me talk to someone about what I need to do for diet and exercise. Because we do know that exercise can help decrease complications from gestational diabetes. And it's really important to try to get about 150 minutes of exercise each week. That's awesome if you can do that. And really good if you can exercise after meals, especially for individuals with diabetes. The other thing with this in advocating on, hey, I have gestational diabetes, what do I need to do now? Someone needs to talk to you about how to check your blood sugars. Typically, they're done 4 times a day. Fasting first thing in the morning, and then you choose whether you want to do 1 or 2 hours after your meals. And if you choose 1 hour, some studies say that that's a little bit more accurate for trying to predict hyperglycemia or high blood sugars. And you're supposed to check that sugar 1 hour after you started the meal. So typically 4 times a day. Fasting first thing in the morning before you eat or drink anything, 1 hour after you had started the meal for breakfast, 1 hour after lunch, 1 hour after dinner. You could also do 2 hours for those after meals, and the after meal blood sugars we call postprandials. So that's 4 times a day. The other portion in here when you're talking to your provider about what do I do once I'm diagnosed, there is something called a CGM, a continuous glucose monitor. Some insurances will actually cover this. And it's kind of like about the size of a quarter as far as the diameter of it. And the thickness of it is actually about that of a quarter, maybe even a little less. And it has this teeny tiny needle on the inside of it that's about the diameter or less of a piece of hair. And you kind of like stick it to your arm or somewhere on your body, and it continuously monitors your glucose levels. CGM, continuous glucose monitoring. I've seen these recently on social media and friends and people that are just walking around with them on, and they're like, oh, I'm trying to do better and eat less sugar, and I want to know what my blood sugars do throughout the day. So these can sometimes be bought not through insurance, but most insurances now are starting to cover these. It helps a lot, in my opinion, because then you're not having to poke your finger 4 times a day. You only have typically 10 fingers. So it makes it very difficult, and it gets really frustrating to have to do that 4 times a day. All right, the next question to help advocate for yourself is, do I need fetal monitoring? Now, I'm going to start this with saying, if you have gestational diabetes and you are controlled, meaning your blood sugars look good with your diet and exercise, then your pregnancy is not at a higher risk of stillbirth. Stillbirth is when babies pass away inside the uterus before birth. So if you are controlled for gestational diabetes, meaning your fasting blood sugars, your blood sugars after meals are looking good, and the majority of them are all normal, and you don't need medicine to control your gestational diabetes, the risks for the pregnancy, specifically for stillbirth, are the same as if you did not have gestational diabetes. This changes if you need medication to control the blood sugars. And don't be worried if you have to start a medication and you're doing all the right things with diet and exercise, because as a pregnancy progresses, the body becomes more resistant to insulin. That's just natural. It really has a little bit of the blame on the placenta because of the hormones, specifically something called human placental lactogen that is being made by the placenta that makes individuals resistant to their own insulin in their body. So sometimes they need to start a medicine such as insulin, where they would have to administer it to themselves, or even an oral medication. And that's where you'd have to talk to your doctor about, hey, how are my blood glucose levels looking? Again, you're checking them 4 times a day. And do I need medicine for my diabetic control? This brings me full circle back to, if you need medicine for diabetic control in this pregnancy, whether you're taking a pill or whether you're administering insulin, this increases the concern or the risk for stillbirth in the pregnancy, and therefore individuals on medicine to control blood sugars need to start something called fetal monitoring. Now, I'll go a step further and tell you what that is. Fetal monitoring is something that is typically started at 32 weeks in instances like this with individuals that have gestational diabetes if they're on medication. And we actually label gestational diabetes a little different. So if you are with gestational diabetes and you are not on any medication, we call you a GDM, gestational diabetes, type A1. If you are on medication, whether it is insulin or a pill, we call you GDM A2. And that's how we can differentiate whether you are or are not on medication for diabetes, particularly for those that have gestational diabetes. The fetal monitoring, there's so many terms that surround fetal monitoring, antenatal testing, fetal well-being. So when we want to do something to monitor a fetus more frequently to help decrease concerns and risks for stillbirth, we do something called, again, we either call it fetal monitoring, fetal well-being testing, or antenatal testing. Some people call it antepartum testing. So many different ways to say it. You can also check out the download that is going into a little bit more regarding fetal monitoring, and that can be found at drlexihill.com/fetal testing. And I think fetal testing is used for most people, fetal well-being testing sometimes. It's different across the board. Then the question is, how do they do that fetal testing, or the fetal monitoring, or the fetal well-being checks, or the antenatal testing, whichever it's called. We make it even more confusing, and we can do it so many different ways. We can do a non-stress test, these two belts that go around the waist, and check two things. The top belt sees if you're having contractions. The bottom belt looks at the fetal heart rate and the tracing on how the heart rate looks. That's called a non-stress test. We just call it an NST. The other thing that people can do is something called a biophysical profile. A biophysical profile checks four things: practice breathing on the baby, movements, tone of the muscles, and then the amniotic fluid level. So the breathing, the movement, the tone, amniotic fluid level. You get 2 points for each. So then if you get 2 points for each, that's 8 out of 8 points. That is considered reassuring. So those are two different ways that we can look at this. Your provider also might do something called a modified biophysical profile. That, to make it even more complex, includes the non-stress test, the two belts that go around the waist, and on top of it that same day, they would check the amniotic fluid level and make sure it's normal. So we have non-stress tests, which I always tell people it's the two belts. We have biophysical profile, which is an ultrasound looking for breathing, movement, tone, and the amniotic fluid. Then we have something called the modified biophysical profile, which is the non-stress test and just the fluid check. To make it even more complex, the next question about asking this to your provider is not only, am I a candidate or do I need antenatal testing or fetal testing, fetal well-being testing? If the answer to that is yes, the next question not only is how are we doing it, NST, BPP, modified BPP, the follow-up to that then is how frequently? Because you can space these out once a week, you can space these out every 3 to 4 days. It's just trying to space it out. You don't want to do 2 sets 2 days in a row constantly because you're not really looking at the full picture in that fashion. But it is different for every place, every institution. The other thing that I always ask people to advocate for with this is how frequently, how are we doing it, and where am I doing it? Some people have you go to your OB office. Sometimes you'll go to a maternal fetal medicine office. Sometimes you'll go to a radiology spot. Sometimes you'll go to an ultrasound center. Sometimes you'll go to the hospital. It's different everywhere. So lots of questions to follow up with when you speak to your provider if they say to you, yes, we're starting medicine for your gestational diabetes, and yes, we need to start fetal monitoring. The final skill I want to help you develop here is the question to ask for those of you who get gestational diabetes in a pregnancy and now you're postpartum. Before delivery, it is great to ask your provider, how can I get set up for my postpartum glucose testing? Or how can I get set up for my postpartum diabetes screening? Or when am I going to do my postpartum diabetes screening? Now remember that of people that actually end up doing their postpartum diabetes screening, about a third end up having diabetes outside of pregnancy. The reason I say of those that get it done, the range of individuals who actually get this test performed goes from about 35 to 75%. Some studies might even have that at the lower end on average. We do know that individuals who get tested more frequently in the postpartum period are those that are higher in age, so typically 35 or beyond, and those who live in a more affluent community. And so the big thing I want everybody to understand is that everyone needs postpartum diabetes screening if you were diagnosed with gestational diabetes in a pregnancy. It's recommended for that screening to happen from about 4 weeks to 12 weeks. So most people have a 6-week postpartum visit with their provider. That's a great time to get it done. And it also is important about every 1 to 3 years thereafter, you're still being screened by your primary care provider, who could be an internal medicine physician, could be a nurse practitioner somewhere with a family practice office, anybody who's doing your annual kind of checkups. Sometimes it actually might be an OBGYN office where you're having a gynecologist kind of doing your annual well woman exam, we call it, and you can say to them, hey, I had gestational diabetes. Can we make sure that I'm getting screened routinely for actual diabetes outside of pregnancy? Remember, up to about 70% of people in their lifetime will ultimately develop diabetes if they had gestational diabetes. And finally, we get to the impact lives portion. And I always try to circle back and discuss why we're doing this, right? So I always tell people I want to help individuals have a happy and healthy pregnancy. So what is it about this pregnancy that would make it happy if we know about this, right? Well, you can find out so many things, and you can help to control the growth of your baby by working on diet and exercise, particularly if you have gestational diabetes. That makes for a happy pregnancy. It also makes for a happy pregnancy if you're trying to control diet, exercise items, as well as things, therefore, that could control maybe the weight gain of the baby, your weight gain throughout the pregnancy, and if you're looking to have a vaginal birth. It can help to increase that too if you're learning all of these items and advocating for yourself. Also, a huge future impact on your personal health for knowing if you have diabetes later in life, and just the fact of knowing that you're at a higher risk because you had gestational diabetes during a pregnancy. All right, I want to go through 3 main points to just recap, and these are some of the 3 things that I would say are big take-homes from today's video. Thing number 1. Everyone should be screened for gestational diabetes in every pregnancy, period, hands down. Thing number 2, if you had gestational diabetes in a prior pregnancy, you need early screening in this pregnancy, like in the middle or the end of your first trimester, early screening. And there are other reasons that you may need early screening for gestational diabetes, and don't forget to ask your provider about that. And thing number 3, if you were diagnosed with gestational diabetes, advocate for getting that postpartum diabetes screening. All right, guys, don't forget to leave any comments below if you have any questions or general comments at all. Don't forget to check out your free download, drlexihill.com/advocate, as well as the download that we have for antenatal testing, which now you know is also sometimes called fetal well-being testing, fetal monitoring, fetal well-being monitoring, antenatal testing, antepartum testing, all those things. So check that out so that you can get a better handle on it and learn more to advocate for yourself and your pregnancy, not only through handouts, but from watching videos, asking questions, and being a part of your pregnancy all the way through, including into the postpartum period. Thanks for watching. I'm Dr. Lexi, and as always, here's to advocating for a happy and healthy pregnancy.